Hey guys, Dr. here, MTFU Longevity over 50, back here with Dr. Richard Carpenos. He helped me a lot with my shoulder yesterday with some level 4 laser. And today he's got a new modality. I do want to talk about the difficulty I'm having sleeping. Unbelievably difficult time sleeping. I get up at 4 a.m. no matter what. It took me 3 hours to fall asleep last night. Plus range of motion. Let's see if we're trying to do a double bicep. I always had a better peak on my right side than my left. I don't have that anymore. In fact, there's more fat back here because I'm having a hard time activating this area because of the shoulder. Range of motion, mind-muscle connection, all that stuff. So as far as sleeping goes, I'm on my side like this. I put my arm like that. I lay on the other side. I lay on my back. No matter what I do, there's pounding, unforgiving pain that I don't notice so much during the day. I don't know if that's because I'm pumping out endorphins and enkephalins or whatever it might be, but I take turmeric, I'll grab some of Denise's Celebrex, I'll do whatever I can, but it's not doing the trick. So, you know, this guy here seems to have the magic, and he's going to tell you what he got today right now.
So this is the best new instrument that is available. It's manufactured by Storz Medical in Switzerland, and very unique to have this, particularly in this country. But if you had this problem and you were seeing an orthopedic surgeon in Switzerland or in Canada, this would be first line of treatment. Here, not so much. Most physicians prefer to inject, steroids and give medications and do physical therapy. And chiropractors do adjustments and ultrasound and hot packs and the laser that we did yesterday. I like to do both the laser and the shock wave. The thing that's great about this is it gives an immediate feedback loop. After a few minutes of treatment, you will literally notice a profound improvement in the condition that you have, if it's muscular tendinous or musculoskeletal. So we have different applicators. This is basically a pneumatic tube, and we have a metal plate at the end. This plate will go against the tissue. The tube will project toward the plate very rapidly. It's a shock wave, and it causes a wave into the tissue. That wave blows open all of the capillary beds and microcirculation, and it causes the body to react and build new blood supply, neovascularization. And that new blood supply doubles down on the old one, so it's bringing more oxygenated blood to this damaged, injured tissue to allow it to heal much faster. It also works on the same premise as a dog that you put the cone over its head when you do work like surgery on its hind leg or it has an injury. The cone prevents the dog from licking the wound because that's a natural tendency in nature to rub a baby's back to soothe it and to lick a wound to make it feel better. Well, this basically takes licking a wound to like 10,000 power. Anyway, so this is called a shockwave instrument. It's also called EPAT or Extra-Corporeal Treatment. It's also called Lithotripsy. It is the same instrument that they use in the OR for kidney stones, to break up kidney stones. You've heard of lithotripsy for that.
Oh, yeah.
But this is invaluable for the treatment of musculoskeletal problems. So we have a little screen here, if you can just show, and we can literally select the type of treatment we want to do. So if you go to the shoulder here, you'll see calcific tendinitis or the periarticular shoulder pain. We're going to do the periarticular shoulder pain, but we can literally get rid of a calcific tendon. So if you do a film of this, do imaging, and you see calcification in the connection, you will break up that calcification, and the spur or the calcific tendinitis will be gone. Well, virtually, once a week for 3 weeks is the protocol. Insurance may cover this. If not, it's $125 per visit. You only need 3 total, and then the rest of the healing you do on your own. But we're going to show today he will have an immediate improvement when we're done. So point to the most tender area. Keep your finger on it when you find it.
Yeah, I'd have to say right here.
Right there.
Yeah.
All right, so over the deltoid and the bicep. So we're putting enough gel on that. And then we're just going to, on the instrument, there's also, it will tell you how many taps we're going to do. Right now we're going to do 1,000. It's a little tender to the patient. They used to do this with anesthesia, but they no longer do because the results are better doing it without anesthesia.
Topical anesthesia?
Yeah, do you feel anything?
Oh, I can feel it.
But it's not uncomfortable?
No, oh no.
So,
Yeah, I'd say a little residual tenderness. You know.
right. So we're at 200 right now. We're going to go to 1,000 in this frequency. Then we're going to change it and do it a little faster. Basically, we're just doing this tapping with a pneumatic device. And then Dr. Dussel will tell you if he experiences any improvement when we're done. It's going to be quick. We're just generating that energy into the tissue. We are at 1,000 almost right now, and then we're going to switch.
How long is this treatment?
3 minutes.
3 minutes.
Depends on the region.
Right.
We also have spine probes. We can do this on the cervical spine, thoracic spine, lumbar spine, knee arthritis. It's amazing if you have osteoarthritis of the knee or damage to the knee. Anywhere where there's a tendon, a muscle, or arthritic joints.
I know a lot of guys getting knee replacements right now.
Yeah, you'd like to avoid that. The hip seems to work better than the knee, but you know, if you need it, you need it. The idea is to avoid it. So we're going to do another frequency, and we're going to do another 1,000. You can hear it sounds a little different.
Now, why the change in frequency?
It's just part of the protocol to get deeper now. We're going to go a little bit deeper into where the bursa is. So we're trying to get to the full depth of this tissue. He's got, obviously when you're a bodybuilder, your deltoids are going to be pretty big. You want to get down into it. This will be quicker, and then we're going to do some percussion after that, and then he'll be able to test it and let you know. You have to be honest though, Dr. Richard. Let your audience know whether you notice any improvement.
You know, I stopped lying in June 2013.
There you go. I don't even want to know what happened that day.
Yeah, well,
It had to involve a court, I would assume, as a lawyer.
it was quite an epiphany.
I love this instrument. I really love it. It's been a game changer in our practice.
Is it new to the industry?
It's new, very new. First one in the country to really use it like this.
Wow.
And it's affordable to just about everybody. I mean, even if you have to, you know, if you can't do the 120, 150, you can do payment plan.
Look, if you can't sleep because of pain, and that's 1/3 of your life, and you value your health,
Exactly.
to me, that's free.
So now this is just some percussion in the area to get that blood that we just kind of blasted. We want to get it flowing a little bit better. It's just a little percussion, kind of like a vibrocussor instrument. Does this feel good?
It does. Dr. Carpenos, you mentioned capillary refill or something to that effect. Are you talking about the development of new capillary beds? Or
New
just
capillary beds.
Yeah.
Neovascularization. Neo meaning new. New vascularization.
Right.
So, you know, as we...
I think that's often regressed in injured areas or underused areas. So that probably makes a lot of sense.
You want to get oxygenated blood to damaged tissue to enable it to heal rapidly. So light is a healer and oxygenated blood is a healer. Try to use every force that nature allows so that you don't take the Celebrex, you know, NSAIDs. Advil wreaks havoc on every part of the body, including the heart, has cardiovascular risks. You know, you'd rather not have to entertain those if at all possible.
I'm happy to say I don't have one prescription right now, except for what I borrow from Denise there.
Yeah, I'm the same way. I don't take any medications.
No.
I can tell you that that is a rarity, though. Like, patients my age are usually on 4 or 5 meds, cholesterol medication, high blood pressure medication.
I read that the average American has 17 prescription bottles in their medicine cabinet.
Yeah. You wonder why Big Pharma is as big as they are. And chiropractic is not big chiropractic, it should be. But, you know, people are skeptical about anything that, you know, we were brought into the world by a doctor for the most part. And when we felt lousy as a kid, if mom couldn't help us, mom took us to a doctor. So we're sort of preconditioned to believe that medicine is the way.
Yeah.
When someone says, geez, you know, we can help you without medicine, you're a bit skeptical. That's understood. All right, so go ahead and see if you notice any change.
Oh, yeah. No, right away I have more range of motion, less pain. It still feels tight, but there's less pain when I do this, I have to say. Definitely more pliable.
Good. So we would have him come back in a week and do the exact same treatment, and then again the following week, and then over the next ensuing weeks to months, it should actually get better and better, you know, provided you don't re-injure it. But yeah, this is, you know, it's a permanent solution, and hopefully as even the day progresses, you should notice that you do even better.
You know, it's like Jack Nicholson, the Joker, said to Batman, where do you get all the wonderful toys? And ever since I've known him, he's always had the cutting edge stuff, so I come here.
I'm a toy collector, I like toys, but if they help.
You are oh, definitely helps. So I'm gonna let you guys know tonight we'll run this video, we'll have more from here. Thank you, thanks Doc.
Appreciate it.
Always the best. And thank you for your filming techniques, and we'll talk to you guys soon, thanks.
Bye-bye.